Wonderful. Well, good morning, everyone. I'm Stefania Nicoli. Here it is. And I'm super excited to present my fantastic team of collaborators in metastasis, RNA biology, and mRNA delivery. So what I would like you to focus today, the next 5 minutes, it's metastasis, which is the process by which cancer migrates for the primary tumor to secondary organ. And when that happens, it happens in 90% of cancer, unfortunately, the probability of survival drops to 10%. We do not have therapy to fix the problem of how cancer migrates in secondary organ. And that's why the market is incredibly high, nearly 15 to 25 billion globally, currently awaiting to develop new type of therapeutics. I want to tackle the problem, particularly focus on triple-negative breast cancer, TNBCs. Of course, it affects predominantly women, and unfortunately, the numbers are incredibly discouraging. Nearly 60,000 new cases of metastatic cases. And again, the market is an opportunity for growth to 8 to 10%. So why are we talking about this? Because unfortunately, why there isn't therapy for cancer metastasis, including mRNA therapy, antibody, etc., they simply don't work for triple-negative breast cancer. So I'm proposing to you today to rethink about how we can think about therapeutic. Particularly, it comes from a new discovery that we are recently in the lab, in which we identify new mRNA, the full complex with focal adhesion, which focal adhesion has essentially, are essentially the fit of each cell. Particularly, cancer use them to move away from primary cancer. And these RNA are essentially trapping focal adhesion protein in a very stable manner. Therefore, what the current problem is that the therapeutic are targeting focal adhesion one protein at a time, and this simply doesn't work. What we are proposing now, a new type of RNA therapeutic that block focal adhesion as a complex. These are a few preliminary data. As you can see, the cells are moving using this complex focal adhesion, but with our RNA technology, the focal adhesions are completely trapped and are unable essentially to move. And this is being proved in a single cell as well as multi-layer. However, what is missing, and is key, a proof of concept that this is going to work in vivo. And that's why what we are asking with this accelerator award is to de-risking the technology to the first proof of principle in vivo mechanism. And we are designing an experiment which is compatible with this accelerator award, in which essentially we will engineer a focal adhesion RNA technology, deliver it to triple-negative breast cancer, and attempt to understand and block the migration potential, of course, to lung metastasis, which we heard is incredibly frequent. This will bring directly to an inflection point and how we're going to deliver our focal adhesion RNA technology. We are already thinking about it actively, and we are working in engineering lipid nanoparticle with antibody recognizing cancer, as well as preventive off-target effect. So in summary, if successful, we have a big vision. The vision implies 3 milestones, which is the first one, which is nearly 50% complete. And I'm happy to say we filed 2 weeks ago the patent, so finger crossed, very exciting. So the second milestone will be reached thanks to the accelerator award, and that will bring straight to our milestone 3, which is a perfect pitch for the development of Wolblavacnic, in which we will test our therapy in much more high complex type of TNBCs, and perhaps any type of cancer that may occur. And with that, I'd like to thank you, and happy to take any question.
Hi, thanks, Stefania. May here. My first question is, what about assessing distant brain mets, for example? You're talking about lung mets right now.
Absolutely. I think it's an excellent question. And because of the first proof of concept, we want to achieve it in the next 4 to 6 months, particularly with this award. It will first assess in the lung metastasis with fludarabine injection, but that will be exactly what we're going to do next in the next phase, which much more complex mouse model.
Cara. Oh, sorry. Go ahead. Just a quick question. Like, how are you going to assess which PD-1 combination will be the best for?
Well, excellent question again. That's why I put together an amazing team of collaborators. They are specifically thinking about mouse models that address this specific point.
Can you comment at all on any safety concerns with this target?
What I can comment, since we don't have any in vivo data, the specificity that we are providing to the table, there is 2 layers of specificity. The first thing, that these RNA are essentially specifically delivered to the focal adhesion protein, so it's subcellularly. And the second specificity layer, it will be through lipid nanoparticle technology with antibody specific, either for cancer or for different type of cancer. So for that, it's looking pretty promising, but this will definitely be taken in consideration. Okay.
Can you talk me a little bit through the treatment paradigm and how you see this fitting into existing therapies? I appreciate you had a nice crumpled slide there, but
Yeah.
The reality is that's the current standard of care.
Of
so
course.
how do you envision this being incorporated?
Of course, pretty dramatic, but I truly believe that we need to reimagine a different type of therapy. And I think the needs in this particular case are so high that we need at least to try. And therefore, the current therapeutic toxicity is incredibly high. Whether our therapeutic will be less toxic, I yet don't know, but it's worth the risk. So we had to do this.
So understood, but then are you suggesting that this therapy is also going to have the ability to melt the tumors that are existing already in addition to preventing metastases?
It is a possibility that we definitely need to consider, because partially the way that the tumor grows is by engaging extracellular matrix, and that particular component, it is mediated by focal adhesion. Therefore, there is a possibility to have 2 hits, restrict the tumor growth as well as the metastasis. So will be in our mind.
Okay. And then the concept of using a lipid nanoparticle is not, that's a very difficult and tall order in the way that you
Understood.
want to deliver this. Is there alternative strategies that the team is thinking about, or other modalities that could be used in place of a lipid nanoparticle, or is that an essential component to this proposal?
We definitely have a couple ideas. One of them, particularly nanobody technology, they're able to link the RNA that we want to deliver specific to focal adhesion. That come to my mind as a first thing, but we are actively thinking about that. Obviously, the lipid nanoparticle, they are the first thing to go for a trial, like in this stage, and then from there on, we'll move